Hello everybody, you probably see two of me today because I've just moved around a little bit. I generally go on too long on these things. I know a lot of us are back at work, so I'm going to try and be as quick and succinct as I can be. And I want to actually do less of the homework, the schoolwork, as I want to just do a little bit more practical. And I do have some which I'm going to stick in there as well, which you might be interested in. Just a declaration, I do not work for Celtic. I do these webinars for them. I'm an independent physiotherapist, but 7 years ago, when I set up Sidi Physio, I'd been working in the military for a long time. I thought, well, you know, some sort of machine would be great. The big thing at the time was shockwave therapy. Brilliant, works very well, but it'll only work on collagenous tissues, and it's not always well tolerated. So I was in a bit of a stump. Looked around. Class 3 lasers would never work because it would take forever. You'd have to be on there for 2.5 days working on something, and you wouldn't get the depth you want. And then I eventually came up across the MLS laser. Got one. I've never looked back. I love it. I use it too much, but anyway, that's beside the point. Today we're going to look at osteoarthritis, and we're going to actually just expand a little bit. But osteoarthritis in the ankle and the foot. We did a little section on the knee a couple of weeks ago. There's too much to do in one session. But what I'm going to do now is I'm just going to bring up some of those slides, and we are literally going to fly through them. As we're going to do this, I'll probably just explain a little bit about the effect of this laser, what this laser does and how it does it, and why it's pretty much better than all the others. But without further ado, let me just see if I can share my screen. Oh yes, oh thank God. Right, let's see what happens here. Right, if I can get rid of that thing, blah, blah. Okay, this should be what we want to do, and hopefully this should all come up. The PowerPoint should come up. Yeah, can you see it? Right, brilliant. Right, focus on osteoarthritis of the ankle and the foot. As I said, we're going to rush through this. Why MLS laser? Well, studies have shown that the use of the therapy can decrease the degenerative process, causing more granulation at the cartilage, so we can actually repair the cartilage. Decrease the prostaglandin level, i.e. prostaglandins, it's the proteins there, the inflammatory proteins which cause our biggest enemy, pain. Pain is the enemy because it causes muscle inhibition. It causes people to go into a chronic degradation in their brains as well. They start moving less range of movement. The one thing we need in these degenerative processes is movement. It's the one thing where we can spray the WD-40 through there, the synovial fluid, and we can get right through the range. You know, I always talk about the rusty bolt. You always wrench it off after you put your WD-40 on, but then you take it out and you put it back in and take it out and put it back in 2 or 3 times because you want to spread this stuff right through. Range of movement is very important, so we need to get all these things moving. It increases levels of proteins involved with tissue repair. Acts on chondrocyte activity. I starts getting the articular cartilage to start a little bit of repair. It's not going to make it 100% better, but it really will stop it getting worse, and it will improve. There's evidence to show it will improve cartilage thickness. How is this all happening? Well, it's happening in a process which is not painful. It's not traumatic. There's no side effects. It offers faster and more effective action on pain, edema, inflammation, stimulates reparative regenerative action without causing micro damage, which is happening with shockwave. Yeah, it says that. What's happening is the laser is sending in 2 widths of light. There is a therapeutic window The therapeutic window on the width of light is between probably around about 780 nanometers and 950 nanometers. It's very weird, but at that stage, you'll just suddenly get the depth down to 5 or 6 centimeters. And if you can put this, this width of light in with power, then you're going to have a massive effect on the cells going down that deep. How? Because it starts a protein synthesis, which starts the creation of all the mitochondria affecting at a cellular level, starts the mitochondria creating ATP. These cells are sick. They can't get the energy they need. That's why they're staying sick. So we actually flood them with mitochondria, flood the mitochondria with oxygen from the ATP, and they start their natural repair process. Also, what's happening at the 808 nanometers width of light is it's getting the anti-inflammatory proteins to bind onto the ATP, and so you get a massive reduction of inflammation. Depending on what hertz you're putting through, you get more of a mechanical effect, which helps with edema. So really, slightly higher hertz is going to get more of a mechanical effect. However, in a very acute situation, we'll keep the hertz lower. But in this osteoarthritis, we are talking about, I'm afraid, a chronic problem. And so, yeah, let's just try and get some flushing through of the waste products through to the lymph, and that's what it will do. At the same time as doing that, working on edema and inflammation and repair of tissues, it's sending in 905 nanometers at 25 watts. Remember, a class 3 laser is up to half a watt. We are sticking 25 watts through here. Some of the machines even have up to 75 watts. This is a huge amount of power. And if you're sticking photobiomodulated light, radiated light through it, that power, you're going to start getting them cooking and smoke and tissue damage and necrosis and all that. And it doesn't happen because the 905 nanometers light is sent through at exactly the same time as the 808, but it's super pulse, on for a nanosecond, off for a nanosecond, on for a nanosecond, off for a nanosecond. What's effectively happening? The tissues heat, cool, heat, cool. You get all the thermal effects of the inhibition of the pain pathways without any of the thermal damage. And the most you'll ever feel is possibly a topical warmth, but you just won't feel things from this. It's just having a huge benefit. And the proof is in the eating of the pudding because the patients will see it. So if I go on to the next slide, I'll probably cover most of what's going to be said in here now. Yeah, here we've got, if you see my cursor, we've got the two widths of light which are synchronized going through at exactly the same time. The 808 continuous wave is sent in at 1.1 watts, which is quite a lot of power, but not enough to start cooking you. And the super pulsed 905 is sent in at 25 or 75 watts, huge amount. And what's happening is we're getting joules, the correct amount of joules delivered to a good depth over a wide area, and we get the changes we really want. Oh God, I should have changed this. There's something. What you need to do is you need to just do the correct analysis, because then you're going to get the optimal result. I.e., just do your investigations, find out what it is. The osteoarthritis thing is quite simple. You can have other problems which are completely unconnected in the autoimmune area with rheumatological conditions, but this will have a massive effect on there because it will reduce the inflammation and decrease pain, which is the biggest problem for these people. The use of frequency and intensity, right? Well, as I said earlier, we generally use a very low hertz on very acute situations. On more acute, it says 200 to 400, but I think this is written by the Italians, and their view of acute is more like up to 4 weeks, whereas we know chronic starts after 3 months. So we can actually probably increase the hertz, you know, a little bit from there as we go along. They have lower intensity in the very acute. The intensity comes up in more of the acute. In the subacute, we're talking up to 400 to 1,000 hertz, intensity up to 75%, and chronic 1,000 to 2,000 hertz, and the intensity is 100%. So you can see in acute, lower hertz, lower intensity; in more chronic, higher hertz, higher intensity. Computer's not working. Okay, so it's normally 8 to 12 sessions, daily sessions. You're not going to be able to get people to do that. Each session lasts 6 to 10 minutes. That's true. What I tell people is 3, 2, 1. That is the pattern you want to follow. 3 times the first week, twice the second week, 1 time the third week, and then continue weekly on the basis of the effects you're getting. Okay, so 3, 2, 1. And I often find after 6 sessions, these people are so much better. There's no need to carry on. MLS modality, the global approach. I've covered this before. I don't want to spend a long time, but we don't just treat the pathology, we treat the surrounding areas as much as possible. So we scan the area, moving the head over these areas, and then we'll work on the pathology setting afterwards. It'll all come clear because I'm going to show you how to do this. Okay. Big point when we're treating any of these osteoarthritic conditions or rheumatological conditions, this laser won't go through the bone, but what we need to do is we need to look for the optical window. We need to open up these joints. So it's just a question of knowing your anatomy and knowing how we can get into these areas. What I tend to do, as probably not the first time, but as second, third times we go, I get them starting doing active movement as we're doing the treatment, which is effectively opening it a little bit, closing it, but it's also sweeping through any the activity is starting a bit of synovial fluid to come through, and it's flushing it right through the whole joint. So active treatment, active movement is always very useful. More of the optical windows, just know where you're treating. The patient we're going to treat today has a metatarsal phalangeal problem. Well, she doesn't really, but and just to let you know, we're still supposed to be distancing a little bit, and I should be covered in PPE. But the patient is my wife of 31 years next week, I think. God knows how. No, she's wonderful. Thank you. Right, so that's the homework, the schoolwork over. Let's get straight back, and I should be back in the room. What we're going to do is we're going to look at the laser. We're going to actually do some settings. I've got a little surprise in here as well, which I want to use as well in an arthritic condition especially. And I would definitely use it big time if there was a rheumatological problem as well, you know, psoriatic arthritis, rheumatoid arthritis, reactive arthritis. And I would use this other thing as well. But what we'll do is we'll then change, we'll have a look over at the settings. Oh dear, I've got the light on there. I'll move it so we can see better, but we'll show how we can do the settings. This is the screen you will get if you have your laser, if you've got the MPHI. If you've got the multi-diode applicator as well, this will appear in the bottom, because when you press on there, it will actually bring up the multi-diode applicator as well. And we can do different settings for a different pathology or the same pathology. So we can actually treat 2 places all at the same time. What I'm going to do today is I'm going to treat this person's osteoarthritis from start to finish in 9 minutes. And that's how quick it can all be, but I'm going to treat 2 conditions at the same time. So we'll go on there. We'll also be able to see us doing the treatment because we'll go on to here. That's not my good side, but anyway, if you can see me there, so we'll be able to see what's going on. You can probably see here, I've got the MPHI, and I've also got the multi-diode applicator on there as well. So I've got the handpiece and the Charlie head, as they refer it to. I don't know who Charlie is. Anyway, let's get back and let's have a look at some settings on this on this MPHI. Right, here we have the screen which will come up. It is so simple, but I just want to go over something very quickly first. What we talked about doing the global approach, when we treat something, we do, we're treating the ankle or the knee. We're going to treat the ankle because that's what we're supposed to be talking about today. And what happens is you've got a little diagram of the foot here, and when I press on the condition I want, it'll give you loads of little points that if I go on the if I press foot arthritis, it's going on all these main joints. It's really pointing out all the joints and everything that can be treated. I would always suggest on the pathology we treat the area which is really causing a problem. So we'll do these lots of little points all round it. So if it's a metatarsal phalangeal joint, I'm going to be concentrating all around here, front, back, or side. I'll be opening the thing up, trying to get the laser light into there to make the changes I want, and I probably won't be concentrating so much on the ankle. They might have a full ankle problem, then we can do that. But we don't want to mess around with a pathology setting because, as we talked about, what we do is we do the global approach first. We want to get some photobiomodulation. We want to get some light into all the surrounding tissues to cause vasodilation, start a bit of activity, cellular activity, and all those surrounding tissues, because it all helps when we come to the pathology. So what I would always press is the scan. It'll come up acute, but as we know in this osteoarthritis, it's generally a chronic problem. So if I press chronic, it will change the settings. Here, 300 hertz, 4 minutes, 25%. If I press chronic, it's going to go 500 hertz, 4 minutes, 75%. It might be an incredibly chronic problem. What this will affect, because it won't give you joules per square centimetre because we're scanning over the area, but it's saying 103 joules are going to go in there. We might say it's very, very chronic. We just want to go a bit more. So we're going to put a bit more in there. It's gone up 136. If we change the hertz, it will come up a little bit more, not by very much. So I wouldn't probably mess around with that. I'd probably do that. But if we wanted to stick a load of joules in there, we could press the continuous wave. So you can see the hertz have gone, and it's gone to 281 joules. Okay, it's doubled it. I'll talk about it later. We don't really want to do that straight away because you can get a rebound effect where we're putting too much power into the energy into the tissues, and you get a bit of a rebound effect which can last up to 48 hours where they feel a little bit worse. Generally, we want to feel better all the time. So we wouldn't go like that on the first time. Anyway, scan, chronic, and we go as the settings are, and we'll start it and we'll treat it. I'll show you that later. What I'm going to do as well today is I'm going to treat the person. I'm going to come off here. So let's set that, and I start it. That's all ready to go with the handset, but I want to treat their knee at the same time. Okay, so what I do is I just press on here, and you can see the multi-diode applicator comes up. I'm going to treat their knee. Okay, so I've got their knee. Knee pain. Okay, 700 hertz, 8 minutes, 100%, 4 points. It's got 11.55 joules per square centimetre. I could actually whack this right up. I'm not going to, because that would be getting a huge amount of power in there. Okay, and all I have to do is press start there. And it'll all come clear because you'll see exactly how this works in a minute. Okay, so actually I'm going to stop this. I'm going to go back to the first. I'm going to stop that, and we're completely empty. Now what's happening is, you just bear with me 1 second. I'm going to change my camera. Right, we should right here. Right, my patient is a lovely old lady who has got, she's got really quite bad osteoarthritis of the knee, but she's just started suffering from very severe pain in her metatarsal phalangeal joint, okay? And we want to try and decrease the problem, the inflammation and the pain in that area. So what we're going to do is we're going to treat both those areas. However, I've got another little tool here, which is the surprise I was going to give you, which is the magnetotherapy, which ACE do as well. Because extremely low frequency magnetotherapy will actually calm the whole system down. It will start increasing the cellular proliferation. It will help repair, but this thing goes right through all the tissues. So what we've got here is, if we come around here, is the magnetotherapy. Now, if you can lie down there, here's my patient, the little old lady, and she's just on there. And what we're going to do, just very quickly, what we do is we get her in 30 minutes beforehand, and what I do is I set it on an osteoarticular problem. What I'm going to do is, it's an acute flare-up really overall of the chronic problem. What I would do here is, I would go press in. Oh, sorry, I should have said as well, there are flexi pads which you can use just for certain areas, but I'm going to use the this lovely solenoid system. We go on here. It's 15 hertz, it comes up automatically. I'm just going to reduce that to 10. I'm going to come across here. I'm going to increase the intensity because it is quite chronic. We're at 80%. It's set for 30 minutes. Right now, post 1, post 2. We can actually scan just any area we want. We can keep it steady just in the middle of the patient. We can have it right up over the head and over the feet. Or what I'm going to do is I'm just going to do the limb here. So on the post, bottom post, I'm going to have it 1, and the post 2, I'm going to have it 3. So I'm just going to be scanning her lower limb. And what I have to do now is press start. And what's happening here, you can probably see, they've come in earlier, we've got some music going, and they're enjoying themselves very happily there. And we really prepare these tissues hugely. I'll explain later, but I've had huge amounts of success with this on rheumatological problems, whereby the patient, they've got one option and a flare-up, and they can actually have their horrible drugs, methotrexate, increase, something like that, and have the joints drained, aspirated, or they come in here, they get on here for half an hour, and then we do a low level, then we do more of an acute setting on the, because of the acute flare-up, on the MLS laser. Anyway, so you can see this is just going between the lower limb. We could have this coming right up over the body, but we don't need to do that. And they quite happily have a lovely rest there. But I'm afraid we're not letting it have a rest, so we're stopping it. We've got other stuff to do. Okay, so if you'd like to come down, and if you want to just go and lie down on the bed, okay. Right, now, with this, what we're going to do, treating the ankle and the knee at the same time, what I want to do here is, oh gosh, I left something out. Just give me 1 second, literally 1 second. We want to do all around the foot and all around the knee, okay? Let's say it's her right knee, it's going to be easier to sort out. To start with, we're going to have it up here, and it's a right toe as well. I'll say first time we're probably not going to do any active movement, but let's open up the joint a little bit. We can still get underneath the patella there if we want. But what I'm going to do is I'm going to treat this with the Charlie head. I'll show you how simple this is. So what we do is we go back to the settings. Right, go back to the settings and we go on to 2 here, Charlie head, knee pain, 700 hertz, 8 minutes, 100%, 4 points. So it's going to be all around this knee, and we'll do on the back of the knee as well. There might well be some synovitis building up in the popliteal cyst, in a popliteal cyst. Very simple. What we just do now is we press start, but before we press start, we make sure that the patient is wearing their glasses and I'm wearing the glasses, because infrared light you cannot see. You will see a red marking here, which is the LEDs just around the head, which is showing you where it's covering. But you cannot see infrared light, and it can bounce off all sorts and cause really quite severe damage to the retina. So make sure you've got this on. You've got your glasses on. Now press start. Okay. Now nothing will happen. You'll see why until I press a button on the Charlie head. So we can do both things at the same time. I'm now going to set this on for her foot as well. So we're going to go on foot arthritis. Oh, I would have done a little scan as well all around here. I'm just not going to do that at the moment. Come out here. Foot arthritis. And what I'm going to do here, leave that 500 hertz, 5 minutes, 50%. This is really causing a quite lot. I'm going to go a little bit more intensity on here. So it's 15 points. I press start there. And again, nothing's happened until I press a little button on here. Now, what we're going to do is we're going to change cameras again. Right, you can see we're all wearing our glasses. And what I'm going to do is I'm going to place this where I want it for the knee. So we're going to come this down here. I'm going to start on the medial side of the knee. This has to be about, well, 20 centimeters away. That is very easily done. I know that is 20 centimeters. So I have it there, boom, on here. And to start it, I just press that. Okay. Now what I'm going to do is, just so you can see the effect of it here, I'm going to turn the lights off. You probably see a bit of a redness coming over there, but you'll see it much more when this finishes. It will automatically stop a quarter of the way through the treatment because it says 4 points for the 8 minutes. So it'll be 2 minutes each area. Okay. What I'll do at the same time is I'm going to start treating her. Oh, sorry, this way. Have a look. Very sore around here, yeah? Very sore. Okay, we're just going to get on here. Press on that. And I just leave that. It will stop. This has got 15 points, so it's going to stop regularly on here. And we'll just keep on moving it around. Can you stop moving that toe a little bit as much as you can? Okay, and stop. Okay, stop here again. Stops automatically. Get in there. As I say, the knee one will stop automatically. It's amazing how long 2 minutes is. When this one stopped again, I'm going to come right around. I'm going to keep on coming around here to get triggers around all the aspects of the joint. Let's start moving it down if we can, up and down, up. Okay, that's good, keep it going. Back on here, going to come in here now. Right, You can see the Charlie head has just switched itself off. I'm just doing the toe down here, but you probably see it a bit better now, because what we're going to do is I'm going to turn this around and come in. Well, I'll move the camera in a second. Let's start that again. There. Okay, so come in this side now. If you've got a bit of a problem seeing that, you can probably see what we're getting in there on the knee there. And we'll just continue with this foot. Okay, come right in here. It is, it's so easy to use. What I think is probably quite an interesting thing to consider, I'll carry on doing the foot as well. But in this current climate, where we have to social distance as much as possible, patients might be a bit fearful of hands-on treatment. We can actually be treating these things. I'm back here or whatever. I've got the thing over there. I'm a good, a good 2 meters away. And so it makes, gives the patient quite a lot of confidence. Okay. I say, we just carry on everything here.
Paul, while you're doing that, can I just ask a quick question? Someone's asked.
Please do.
About power. Gareth said, if 75 watts can burn, why would you use 75?
What the 75 watts won't burn if it's modulated correctly, which it is. What the watts will do will speed up the time. If you look at the old Class 3B lasers, they couldn't get enough power in. You'd be not treating something. We know the science is there, but you'd have to be on the tissues for an hour or so or more to get any effect. And also, they couldn't get the depth. Now we've got the power. We've got to modulate it correctly, otherwise we'll get damage. 75 watts or 25 watts, it's fine. It doesn't really matter if the watts are very high. What has to happen is you'll see the difference on the 75 watts. It doesn't work exponentially. But if I've got 8 minutes, I was doing this here, it would probably be 6.5 minutes with the 75 watts. It just speeds it up. It's going down to the depth it wants. It's going all the power that it wants to that area, but it won't change the actual joules per square centimetre which are going to that area. You can actually arrange whatever you want there. It just speeds it up. You'd have thought 75 watts would be, 3 times quicker. It's not. It's probably 25% quicker. Does that make sense?
Yes, yeah, thank you very much. And Brendan's just asked, is it necessary to use scan setting on the wand if you're performing manual therapy?
Sorry, say again, Phoebe.
Is it necessary to use the scan setting on the wand if you're performing manual therapy?
Yeah, I would say yes, because you're going to be scanning. Look, let me stop this. I'm going to stop doing the one, because what we're doing is the treatment period is 5 minutes on the 8 minutes on the Charlie head, and it's 5 minutes. This is why we don't need to scan when we're using the Charlie head, because we're doing a double whammy in there over a bigger area. With the wand, it's 5 minutes, but the scan. Let me just show you. If I come back to here. What I'm going to do is get the patient just to turn over here, because I want something in the back of the leg, and I can still do a foot because it'll be over the edge. Okay, so right now, sorry, we're back on here. On one, I'm stopping what we were doing. We were doing the treatment. I would have normally just scanned, but I wanted to save a bit of time. But what we would do is we scan first. We will get the photobiomodulation through all the tissues. It'll take 4 minutes. It's no time. And we know the treatment, the pathology treatment is 5 minutes. That's 9 minutes in total. And the other thing, the Charlie head doing everything up there on the knee is only 8 minutes. So as I said, I'm treating 2 conditions in 9 minutes. Because look, we do the scan, we press the scan, we say, look, it's a bit of a chronic situation, this. And I could even be, I could say, look, it's a real problem, it's been a long time. Let's just go a little bit more. So we just increase the jewels slightly and we press start. Okay, let me go back to the other camera. Right, now what we've done is we turn the patient over, that's the right leg, and we're now going to get into the back of the knee here. Just check the distance, that's absolutely perfect. Perfect, okay, and we're going to get in there, okay? And you can probably see from here, it's coming all area. Right, now what I should have done for the toe is I would actually start the scan down here through the plantar fascia, through the foot. So let's start here. I set this going and I start the scan now, okay? And just 4 minutes, literally 4 minutes, I'm doing all the surrounding tissues, coming down here. Let me see if we can bring this down a bit closer so you can see a bit better. Right, I'm scanning right through here. Are you ticklish? Right through the whole area, everywhere. And on the dorsal aspect as well. Try and get yourself in a better position. I'm actually bent right over, which I should be. But and as I say, this is literally only 4 minutes. Then you go straight on to the pathology setting at 5 minutes, 9 minutes in total. Whereas at the same time, I'm literally doing nothing because you can probably see over there, her knee is being done at the same time as I'm doing this. Okay? And actually, that's this because we stopped. But that's all finished. The Charlie head's finished now, and her knee is done. And we carry on this, and when the scan is finished, it will just automatically stop. You don't need to do anything to it at all. It just stops itself, and then you move straight on to your pathology setting.
Paul?
Stop it here, because I want to, there's something which I didn't probably clarify very well. I'm just thinking back now. Let's get back onto okay. So on one, you can always check what's happening with the two. The two is finished now. It just stopped itself. But on the one, on the handset, we're still in the scan. If I kept this going, you can probably see it's still counting down the time and counting up the joules. And it just does this till it comes to an end, okay? But what I didn't point out, I'm gonna stop this now. It comes back to here. What I didn't point out to you was, when I do the scan, I can choose chronic or acute. Very simple. If I do the pathology setting, here we've got, gives you what it wants to do, but if I press acute or chronic, it won't make any difference. And this is where you've got to use your brain a little bit. Say, look, this is a very chronic situation. It gives you rather a safe setting here on the pathology, but I know we need a bit more power in here because it's saying it's giving you 1.87 joules. I want a bit more, and I'm going up to 75%. I said, actually, you know, let's give a little bit more in there. Okay, 3.62. I could have. That's probably what I'd stick to. I could have gone, if I go down to count at 50%, 1.87, I could have pressed that and go to 3.96. It's just another way of doing it. But now we've just got a continuous 808 nanometers, and we're getting double the joules in there straight away. I'll come back, I'll show you a little drawing I do, which might explain how that CPW thing is working. Let's come back to the main bit here. Right, we're back in the room. I'll get the lights on so you can see my drawing. As I told you at the start, we've got 808 nanometers and 905 nanometers going in there. The 808 nanometers at 1 watts, and it's working on the tissue repair, it's working on the reduction of inflammation, working on the reduction of edema. We've got the 905 going in there up to 25 watts or even more. That is working on inhibiting the pain pathway. So you've got this synergistically activity going on between improving the tissues and reducing inflammation, which will naturally reduce a bit of pain, but then you've got the pain pathways being blocked. So they work together and help each other massively. Now, the settings you have on those all accounts for the joules per square centimeter, which are going in there. Right now, this is a bit amateur, but hopefully you can make out what I'm showing you here. This is what is happening. We've got here the 808 nanometers, okay, the frequency, and this displays that. So it's off and it comes on. So it's continuous on there, but it's what we term a chopped pulse. So off, back on, and off, and back on, and back off, and back on, and off, and so on. And that is your 808 continuous but chopped, okay? But we can make it completely continuous. Now, before I get there, what we've got here is the 905 nanometers, which is referring to this, okay? Every time this is on, you're getting this synchronized loads of nanosecond pulses of the 25 watts or the 75 watts coming through here. Boom, 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 boom. And that is your pulsed wave. So you've got this continuous or chopped going through, boom, boom, like that, and the synchronized 905 going through at the same time. When we press that CPW, we stop the frequency setting, and the frequency figures disappear completely, because what happens to this 808 nanometers, it just becomes completely continuous. So we're actually on power much longer, and we've got this going through more as well, okay? Which therefore that accounts for literally a doubling of the joules per square centimeter. But we always have to be slightly careful to avoid this rebound effect. As I explained, you can't saturate anything. If you give somebody a shockwave at way too much power, you're gonna kill them, okay? Tissues, they like to be looked after, they like to be given the right amount of power. And this is why the settings on this machine are generally reasonably conservative, but not massively. They're very good. I could use those if it's a slightly acute situation, but what I do is I build it up, increase the hertz, or probably more probably increase the intensity just to bring the joules up in more of a chronic situation. I very rarely go straight onto the CPW because that is just whacking things up massively, and it's very likely you're going to put too much power in there, and that will cause a rebound effect where they ring you up the next day and say it's actually worse. Well, it's worse because you've been a silly Billy and you've slapped in far too much power. So these guys at ASA, they're pretty clever, and they've got some pretty, beg your pardon, it's not COVID-19, and they've got some very good settings, and then you can just increase it a little bit as you feel it's needed, depending on the chronicity of the problem. But don't be silly. Don't just go straight away, because I could show you on there. We could change something from which is 4 watts per square centimeter, and just by messing around with the intensity and thing, I'll go straight up to 26 joules per square centimeter. Well, I can pretty much guarantee you're going to cause a rebound effect if you go in straight away with that. But use a protocol with the patients. Have the patients speak to you. You give them the treatment, give me a call the next day. How was it? It's actually feeling pretty good. Right, that tells you we're on the right lines, and if we can possibly just increase a tiny bit. If you ring up and say, how was it? How is it after yesterday? And say, do you know what? I don't want you to, it actually feels a bit worse. And you go, you don't even have to scratch your head because, you know, I've just been a complete idiot. Because what I did was I pressed the CPW straight away and I smashed them full of, it's very obvious, very clear. I've smashed them too much power in there, which has had a bit of a poor effect. Right, look, I think we'll stop there and take any more questions. Does that help? I've tried to cover a bit more of a practical side of it, and I've tried to show you that we can use, you can use both these things together, Charlie head and just to save time, because you could do the scan with the Charlie head whilst you're going straight on with pathology. So you can reduce your treatment of the arthritic foot or ankle down to 5 minutes, literally 5 minutes. Or we can do 2 pathologies. I did 1 pathology on the osteoarthritis on the knee. I did the osteoarthritis on the foot. I could actually done completely different pathology, just change settings. So with the Charlie head and the osteoarthritis with the on the foot, or vice versa, and you can do all these things at exactly the same time.
Fantastic, thank you very much, Paul. I had a couple of questions while you've been talking. Somebody's asked, well, Gareth just wanted clarification on the 75 watt thing again. So really the only benefit of 75 watt setting is the speed of it. Is that what you were? Yeah, literally that's what's going on, because the joules delivered are going to be whatever you set them at. What it's effectively going to do is speed it up. There is one other little thing which I know the 75 watt machine will do. It has an acupuncture head fitting. Now, I don't want to talk on this because I don't know much about it. I do acupuncture. And if I want to do acupuncture, Celtic aren't going to like me for this, and ACE aren't going to like me for saying this, but why would I use the machine? I'm an acupuncturist. I'm going to use the acupuncture and do the laser as well. What is actually phenomenally effective is often I've had a patient with neck, back pain. I will say, look, let's get the acupuncture. So I do my meridians, I do my the points I want on the acupuncture, and then I use the Charlie head above there. So you're getting the effect then throughout all the surrounding tissues of the photobiomodulation. But I think there's some carry on through the needles as well, and you just get some stupendous results. Oh, fantastic. And someone else has asked whether so they've had experience of an Omega Class 3B laser, and apparently that was sold to them as being amazing, and it really wasn't that great. So is the machine made by ASA actually as powerful as it says it is?
Well, yeah. If you take the wattage, your average wattage, I mean, your mean wattage is probably in the region of around about, because you got the 1.1 and the 25. It's probably in the region of mean, probably about 8-9 watts. Okay, and my maths isn't very good. But that's what we're talking about. But we've got the different things. We have that's because it's synchronized. That's the two things together. But you see, what we're saying is we have 25 watts going in that. Yes, that is absolutely fact. We've got 25 watts going on the 905 nanometers. We've got 1.1 watts going on the 808 nanometers. Now, no other machine can give you. They would say, oh, well, look, our mean is probably 10. But it's on something which doesn't really work quite as well. Because if you have, it's not super pulsed, it's not accurately pulsed. Some of these other lasers, they say, yeah, we're pulsed. But the way they pulse things, they send through different widths of light in sequence. So 600, which isn't going to do anything because it's out of the therapeutic window, 600, 800, 900, 980. 980 is just going to cook because once you go above 950, the depth goes straight to the surface, and all it will do is cause scatter on the watery dermis tissues there. And you'll just feel incredible heat so quickly. So unless you've kept that thing moving really quickly, you will see smoke coming out of the person. I mean, you could be on the person and somebody walks through the door and say, yeah, what is it, mate? As you stop moving it, and a bloody hole appears in them. So you just got to be careful with those things. There is no danger whatsoever. We can keep it static for certain treatments, or we do the scan and we're moving it anyway. But what we do know is we know the wattage of the 905 nanometers is 25 watts or 75 watts. We know that the 808 is 1.1 watts. Now, if you want to then do a mean of the two overall, you can do. But no other machine would do that because they say, look, this is what we're giving at the different widths.